As I understand it, Medicare for all would be, we're going to include everybody in a single payer. You have Medicare for more, which would take the age down from 65 to 50.
Right.
How would you pay for that?
Well, first of all, this is voluntary for somebody who retires early. Maybe they're forced to retire early because of layoffs or find themselves in a situation where they can't find affordable insurance because it is more expensive for people between 50 and 65, and they're more likely to be using more medical care. And so this is something that somebody would buy into with premiums. We do it as a separate pool from Medicare at 65, so it doesn't impact Medicare at 65, other than one thing that I've heard from doctors, which is we have a lot of people right now that are deferring cancer screenings, checkups, treatments that they need to get to 65, and that actually if more people were able to get a very affordable policy under Medicare earlier, it would actually save money for Medicare. But this it's something that would go on the exchange like other options, and if you qualified for tax credits or cost share, you would be able to do that. So we know it would be eminently affordable. Everything that we've seen is that it would be less for those individuals, and it would actually strengthen the private sector market for those who are 27 to 49 who are in the private insurance market.
Well, that is one of
and the best thing I would just say, David, that this could be done right away. It's not new bureaucracy, no debates here about big structural changes. This could just happen now, save money, and be able to allow people to be able to get more health care.
What I was going to ask was about the private sector, because you mentioned it with respect to the younger people below the 50-year low. How would it affect the private health care system generally? Because as you and I have both seen over the years, when fundamental changes have been proposed in health care, often the private sector objects, to put it mildly.
Sure.
Would they be in support of this? What are your discussions right now with private insurers, with private health care providers?
Well, I think, as you just mentioned, I think that the first reaction is always to be opposed or concerned about change. As we talk to people, though, they are really listening and looking at this for what it really is. This is a choice. People have great private insurance. I can't imagine they wouldn't keep it. This is really for those who are in a situation where they have retired early, been laid off, can't find affordable insurance, and so it actually takes pressure off of other parts of the private insurance market. And the more people look at that, the more they're open to it. So, and we're not talking about a whole new bureaucracy here in order to be able to do it.
So finally, Senator, as a fellow Michigander, I don't want to let you go without getting your thoughts on John Dingell. Served the longest of any human being in the Congress from the southeast of Michigan for all those years. What are your thoughts about his legacy?
Well, David, as you know, he was a force and to be reckoned with, not only on behalf of his constituents, but here on Capitol Hill. When we talk about Medicare, he actually was there and helped pass Medicare, held the gavel at the time that it was passed, as well as the Affordable Care Act, as well as balancing being a champion for the auto industry and at the same time addressing our way of life with the Clean Water Act, the Clean Air Act. So he touched every part of our quality of life in this country. I was honored to serve with him and have him be a friend. I will say, though, finally, what I love the most is John loved people, what he called his people, and he came home every weekend. He was in every parade. He fought for people. What motivated him, which I think makes an incredible public servant, is somebody who cares deeply about the people that he represents, and that was John Dingell.